Hello, good morning, children. How are you? I hope you all are doing good. It was so nice to have a Google Meet yesterday with you. Really enjoyed, and I hope you all have learned. This is our last lesson from the Block 15 role of the state government. Today's topic is access to the health healthcare. So let's start our lesson today and let's see what's in store. It's a continuation of our lesson 3, public and private healthcare. So, Block 15, role of the state government, topic access to healthcare. So, today's date, and let's do a little review before we start our lesson. In this Block 15, we have covered the features of the state government, under which we have learned legislature, executive, judiciary, and how state government is formed, the role of an MLA, functions of an MLA, and the difference between public and healthcare, which we are going to continue today. So let's do a little overview of our last class so that we'll do continue. What was health? We have discussed health is a stage where we are without any disease and peace of mind. So health is the ability to remain active in our work and daily lives. India has a huge network of public, government run and private hospitals and medical colleges, yet many people even today do not have clean drinking water, nutritious food, and proper healthcare services. And the government must do something to get equal access to necessary healthcare services to one and all. What is the learning objectives of our today's lesson or the lesson goal? Today's lesson will be able to analyze why people face challenges and have unequal access to healthcare despite government efforts. Government is doing a lot of things, but why people are having so much differences? Let me ask you a question then. Why is there so much difference in public and private healthcare facilities in India? I know you, all of you know this answer as we have discussed all this in our last class. So, what is the basic thing that we are going to discuss today? Here I have given you four important points, which is the difference for these two, private and public healthcare. Number one is population, because India is so big that it can't provide proper healthcare facilities to everyone. Second, lack of resources. Government also do not have all the resources everywhere, and public also, people also do not have resources sometimes to go to the desired place to get the medical care, and those who have resources they go. Third is corruption. Sometimes proper facilities government provides but it doesn't reach to the public, or because of due to carelessness sometimes proper facilities are not provided to the people, and sometimes some proper schemes come but which public never receives it. And number four is ignorance. As I said, many policies and schemes come, sometimes people do not know them, and because they do not know them they cannot use them, and sometimes government is also unable to communicate them. So these are the most four important points why there is so much difference: population, lack of resources, corruption, and ignorance. This is an Indian healthcare system. What state it is right now, we have already discussed in last class. So let's see. India is the fourth largest producer of medicine in the world. Fourth largest producer of medicine in the world. But India is so big that it, even with these resources, it cannot provide everyone everything. And many people, even today, don't have clean drinking water, clean toilets, and neighborhoods to stop the disease, and nutritious food. These are basic amenities people don't have. And although many Indians become doctors and nurses, but most of them go to the cities for the jobs, and some go out of India for the jobs. So the villages don't get healthcare or have to travel long distances to get healthcare facilities. India also gets lot of medical tourists for their treatments. In Asia, many people come in the Asia, many people come to India for treatment because it is cheaper to them. And due to this, even in India, some people don't receive the services because it is catered to so many people, plus India, plus outside, so you can understand. In order to prevent or treat illness, we need proper healthcare facilities and we need to have proper health centers, especially hospitals, laboratories for testing, ambulance services, blood banks. These are must everywhere, villages and towns as well. India has a lot of knowledge and experience in the field of healthcare. and it's public, run by government healthcare system, looks after many people across India. We have knowledge, we have experience, and we government does many things, but still there are many more things to be done. Case study. There is a case study given in your book. A boy named Amar, 5 year. His father is Ranju Maji. He is a farmer from West Bengal. Amar is suffering from a lung disease. So Amar's father take him to an village hospital where doctors say that I cannot treat him because we do not have the facilities. Take him to a city hospital or go to the town. So Amar's father take him to the town. But if you know, when you go to town and go to big hospital, what happens? These hospitals are overcrowded, many patients, beds are full, there are facilities, but people don't get it sometimes because it is full. And this is same with Amar. He did not get any bed. So somebody told Amar's father, please go to the private hospital and get your medical facilities. But Amar's father realized that he doesn't have that much money to go there. So in the end, Ranju Maji, the father of Amar, he started to thinking whether his son will be cured or not, because government he is not getting seats, private he cannot go. But here you can see what is happening here. Here three things are happening. One is lack of resources. Ranju Maji doesn't have resources. Number two is ignorance. He doesn't know. Even there are no beds, he must approach to the government hospitals, or he must visit some other government hospital of the city, or talk to someone and at least try to get it. Yes, he should be done without talking also, but sometimes this is needed. He's ignorant, so he doesn't know. Third is, see the distance, accessibility. It was not there in his town, so he has to come so far, so he's staying expenditure. But still there must be something done. But this is the sad story which happens in every villages, and we pray that these incidents don't happen and people get well. But you have understood why this is happening, because lack of resources, corruption is there, and this the it is far away, distance matters, and then this is because overcrowded population matter, and the most important is ignorance of his father also. He doesn't know everything. Now inequality. Why this inequality? Someone is getting bad and someone is not getting bad. Why there is inequality? It is because India is a democracy, but not all Indians get equally good health care. This is because the population is very big, and only 20% of the population can afford medicine in the private hospitals. And all these hospitals and everything facilities are in the cities. So but in India, majority of the people live where? In villages. And also most healthcare system in town and cities are in private. So 40% of the patients in hospital, they can't afford that private hospital. So whenever somebody is sick, either they have to borrow money or they have to sell off their things to pay the medical expenses. This is the inequality, you can understand. Next is inaccessibility. Accessibility means not reachable. Not reachable. So number one is physical reach or accessibility. Sometimes it is not possible for people even to reach to the village hospital. Why? Because 5-6 village, one hospital. And from the village, the hospital is 10 kilometers, 15 kilometers. So, and road of the village, no proper motor, so no proper vehicle facility, so sometimes it is unable to reach there. Second is availability. Even if you reach there, there might be no doctor, might be no nurses, might be no diagnostic, means testing things, and might be there are so many problems not there, so they will tell you to go to town again. So see, availability. Third is quality and functionality. So doctor is there, nurses is there, but whether they are functioning, whether they are working, whether things are working there. Last is affordability. Even from a village to take someone to the hospital, this 10 kilometer, 15 kilometer also sometimes village people cannot afford it. And even if they afford, they go to the hospital, some expenses there they have to do, that also sometimes people don't have. So treatment is there, medicine is there, doctor is there, hospital is there, but still there are some other things also. for which government always come up with scheme, give insurance, like recently one is launched where people can get medical facilities, Ayushman Bharat, but people do not know or people are not getting that benefit sometimes. So this is one of the reasons. Next is solution and conclusion. This is our conclusion of this lesson. From this lesson, we have understood that India is a democratic country. We know, and it is government responsibility to provide healthcare facilities to all its citizens. Basic medical facilities should be available to everyone, everywhere, and not just to rich people in the cities. In the rich people, for the rich people, cities no problem, but villages and especially poor people in the villages or in the town having problem. So that needs to be taken care, and it is government's duty to work together and improve the health of the nation. This is the conclusion we have come with this lesson. Now we'll to see solution. These are permanent solution, but we'll see two solution done by one by a state, one by a country, and we'll see how it has impacted. First one is Kerala. Kerala is an Indian state. In Kerala, what happened? In 1996, the government of the state of Kerala gave 40% of its budget to the rural panchayat, means to the local self-government. So the local self-government got the freedom to provide for the needs in their villages. And this led to some positive changes as the money was used for the betterment of all the facilities in the village. For example, proper planning was done for water supply, education, working of schools, etc. and medical also. So you can see sometimes if the government provides the money, instead of they doing something, they provide the money to the local government, panchayati raj system, or the ward, to the respective ward or the constituency, and then they do their work, then sometimes better results and positive results we see. So in this example of Kerala, we see that it has really helped Kerala in receiving water supply, education, schools, and medical has been improved, not to the best, but yes, it has improved a lot because money was directly given to the local government. Another example is Costa Rica approach. Costa Rica is a country where the government decided that they are not going to have any national army. That means they are not going to have big army, and they are not going to spend any money to manage the army. So whatever money they are going to do for that, they are not going to do, and instead that money they are going to use it for the people, for people project, for people's health, education, meeting basic needs of the people. So when Costa Rican government took this step, because it believes that a healthy population is the most important factor in the development of a country. So what happened? Their country was more happy, people are more disease free, and Costa Rican is a now good and happy country. They do not have much army, but they spend more money on education, health, and meeting people. So this way country is developing and people are more healthy. This is our goal, and we pray and we believe that one day our country India also will be a healthy India where citizens are health aware and engaged and have equitable access to affordable health coverage with a focus on prevention, early diagnosis, and assured minimum quality of care offered by a vibrant and sustainable ecosystem of public and private players both. So this is our goal, that one day India will achieve all of this. Now let's go to the assignments and announcements. Read the section Access to Healthcare from your content book, page number 22. Complete my learning chart in your content book, page number 23. It's a very easy one. I know you can do. Complete PQ question 10, which is a thinking question. So you think it and write it in your own, in your note copy. And AQ question is only fill in the blank, something is there that you can do your content book. Log into your Google Classroom and do the assignment. This time I'm going to give one more assignment question, which is going to be very easy, like thinking about what more government can do and all this. And whenever you put the answer, don't be too much supportive of private or don't be too much supportive of government. Think a solution, find a solution, like you have seen in Kerala example, you have seen in Costa Rica example. What government can really do to bring a solution? Not that this is bad, this is good, okay, we must use this. No, we have to find solution. That's why we are studying this lesson and studying all this. Lastly, thank you. Stay home, stay safe, Take care, study your lessons. Any problem, contact me, do the assignments, and once again, best of luck.